Hi, my name is Andrew Denton, and I'm a DNP student at Franklin University, and today I'll be speaking on Door to Balloon Times Clinical Practice Guidelines. So, Door to Balloon Times. According to the American College of Cardiology, the Door to Balloon Clinical Practice Guidelines were initiated in 2006. And the ACC recommends that patients suffering from ST elevation myocardial infarctions, better known as STEMIs, undergo percutaneous coronary intervention within 90 minutes to reduce patient mortality risk. And Elhini et al. Explains that risk, that acute myocardial infarction mortality risk increases 8% per year for every 30-minute delay to reperfusion therapy. And this specific clinical site, they have a system-wide goal of 60 minutes from door to balloon time to improve patient outcomes. And that was taken from an interview that I had with a quality leader, Liz Smith. And in 2025, this specific facility's average time from door to balloon is 48 minutes. So there is a standard nursing order set to improve door to balloon times. The door time begins right when the patient arrives to the emergency department complaining of chest pain. The standard order set, according to Liz Smith, my quality outcomes manager, is a goal within 15 minutes. They have to have these things done in the emergency department. So first they must get a stat EKG with immediate interpretation from the physician at the bedside. And once it is confirmed, they activate a STEMI alert and page the cath lab team. The nurse then gives 324 milligrams of chewable aspirin, 600 milligrams of clopidogrel, and 5,000 units of IV push heparin. The nurse must also have a total of 2 IVs and draw some labs, pertinent ones being troponin level, complete blood count, and basic metabolic panel. And then that nurse must personally transport the patient to the cath lab. So there is a new electronic app that the cath lab team is implementing, and that app is called OnPage. It is to improve their STEMI alert notifications. So the initial STEMI alert pages were not being sent properly or went unanswered 18% of the time when using the traditional paging system, where each team member held a pager and then had to call into the transfer center to confirm they got the page and they were on the way to the hospital. So in order to improve that time, this facility had implemented the OnPage system, and some benefits of it. It is HIPAA compliant. The unanswered alerts are automatically escalated to the next patient, to the next person. So if the first physician is unable to answer their page or notification, then it will escalate to the next interventional cardiologist. If there's a nurse that is unable, it will escalate to the next nurse, and if there's a rad tech unable, it will escalate to the next rad tech. So another nice thing about it is responders can attach files, images, or notes. It's really nice for the physician, the cardiologist, to get the EKG sent to them directly, and they can interpret themselves and interpret which blood vessel that is most likely infarcted. And that way they can go straight to that blood vessel and prepare to balloon. And another nice thing is team members can securely message each other. Traditionally, there's no communication between team members in the paging system. So this one's pretty nice that you can communicate openly with each other. And this alert is loud and persistent, and it bypasses mobile device silences. So even if your phone's on silent, you don't have to worry. You're going to hear that alert loud and clear. And since this implementation, not a single STEMI alert page has been missed or unanswered by cath lab team members. Here's a list of references. Thank you for listening. Have a great day.